Bird fancier's lung or hypersensitivity pneumonitis is a lung disease that mostly affects people who breed birds. Imagine this: when someone breathes near birds without a safety mask, tiny particles of protein from feathers, droppings and bird dust can get into their lungs. Over time, these particles can cause inflammation inside the lungs, in the tiny air sacs called alveoli. It's as if the lungs are irritated all the time. This can lead to breathing problems, like asthma. That's why it's super important for people who work with birds to know about this disease, because it can be extremely dangerous for their health. Taking care of birds can be really nice, but you have to be very careful and avoid breathing in these harmful microparticles. It doesn't matter if you're young or an adult. If you spend a lot of time where there are many bird particles floating in the air, you could have problems without realizing it. It's a silent danger. In this video, we're going to learn exactly what bird fancier's lung is, what the symptoms are, who is most at risk, and how to prevent and treat this disease. Hypersensitivity pneumonitis, also known as bird fancier's lung, is a disease that causes severe inflammation in the lungs. To understand it better, imagine that our immune system, which protects us from diseases, overreacts in an uncontrolled way to something it shouldn't. In this case, it reacts to the small particles found in the feathers, droppings, and secretions of birds. When a person breathes in these particles constantly, their immune system may start attacking the lung tissue by mistake. Over time, this immune system response causes inflammation and scarring in the lungs, making it difficult to breathe. If the inflammation in the lungs continues for a long time, it can affect the ability to breathe properly. This not only makes it difficult to exercise or do physical activities, but it can also cause more serious problems, like recurring lung infections that keep coming back. That's why it's important to take hypersensitivity pneumonitis seriously and take steps to prevent it. Detecting the disease early and taking preventive measures is essential. The symptoms of bird fancier's lung can be different for everyone and are sometimes confused with other respiratory illnesses. One of the most common symptoms is a persistent cough. Another important symptom is difficulty breathing, known as dyspnea. Fatigue is also common. See a doctor if you have these symptoms. Bird fancier's lung mainly affects people who are in contact with birds on a regular basis and for long periods of time. Bird breeders, whether as a profession or hobby, are the most vulnerable group. These people spend a lot of time in aviaries or near bird cages, which increases their exposure to bird allergens. Pet store workers are also at risk. These employees handle birds daily and often work in enclosed spaces where bird particles can build up in the air. If there is no good ventilation, the concentration of these allergens can increase, putting employees at greater risk. Veterinarians specializing in birds can also develop bird fancier's lung. In short, anyone who has birds as pets and spends a lot of time caring for them may be at risk. Education, awareness, and knowledge are key to preventing this disease. To prevent bird fancier's lung, the most important thing is to reduce exposure to bird allergens. One of the most effective measures is to improve ventilation in places where birds are kept. This can be achieved by using air extractors, fans, and opening windows to allow fresh air to circulate. Another preventive measure is the use of personal protective equipment, such as masks and gloves. Filter masks can help reduce the inhalation of bird particles, while gloves can prevent direct contact with allergens. Treatment for bird fancier's lung usually involves anti-inflammatory medications, such as corticosteroids. In severe cases, stronger treatment, such as immunosuppressive therapy, may be necessary. In addition to medication, it is essential that affected individuals avoid further exposure to bird allergens. The help of a respiratory disease specialist can be crucial in creating an effective treatment plan. Maria Lopez, a canary breeder, started feeling tired and developed a cough that wouldn't go away a few years ago. At first, she thought it was just a cold, but since the symptoms didn't go away, she decided to go to the doctor. She was diagnosed with bird fancia's lung and had to make big changes to her routine to take care of her health. Juan Perez, a pet store worker, also suffered from hypersensitivity pneumonitis. He developed a chronic cough and shortness of breath that prevented him from working well. After receiving his diagnosis, Juan began wearing masks and improving ventilation at work, which helped reduce his symptoms. Ana Martinez, a veterinarian specializing in exotic birds, had to stop working for a while to recover from bird fancia's lung. During her recovery, Ana researched different ways to manage and prevent exposure to bird allergens in her clinic. These stories show us that although bird fancia's lung can be a limiting illness, it is possible to control it with proper care. Bird fancia's lung is a serious illness that affects those who are in frequent contact with birds. It causes uncomfortable symptoms such as coughing, difficulty breathing, fatigue, and weight loss. With preventive measures and timely treatment, it is possible to control it. It is essential that breeders and veterinarians are aware of the risks. Implementing safe handling practices and using personal protective equipment are essential. Protect yourself. Take care of yourself, please. And thank you for watching this video. Putting this into practice to take care of yourself is the goal of this channel. If you value your life, like, share, and subscribe to reveal more secrets.